So welcome. Today, we're talking about integrative psychiatry and nutrition for mental health. And if you want to learn more about how to improve your mental health, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And I'm the founder of Pacific Integrative Psychiatry. We're an online mental health practice in California. And we see adults with anxiety, depression, and sleep issues. And we also provide nutrition services for mental health. So today I'm joined by two of our team members at Pacific Integrative Psychiatry. We've got Josh Habansky, who's an integrative psychiatric nurse practitioner, and then Ailar Poormoghaddam, who is a certified clinical nutritionist. And both of them have training in integrative and functional medicine. So I'm excited to chat with you guys today because we're all passionate about integrative health, functional medicine, and helping people beyond the usual conventional treatments that we typically see in the psychiatry world. So I'd love to hear from you, Josh. What is integrative psychiatry? What does that mean to you? What does that mean for a patient? Because I know a lot of people are not really familiar with that term. And there's also integrated psychiatry and integrative psychiatry. Those two terms often get mixed up. So maybe we can try to clarify that for people as well today.
Yeah, so I'll start with your second question first. Integrated psychiatry is actually when psychiatric services are embedded in like a primary care setting. So someone will be able to see their primary care provider, maybe also a therapist, and then also a psychiatric provider in the same practice. Integrative psychiatry is, in my opinion, a more holistic way of kind of looking at someone's mental health symptoms, whether that is depression, anxiety, insomnia, PTSD, OCD, ADHD, anything like that. So whereas conventional psychiatry tends to focus more on like neurotransmitters and how they play a role in people's symptoms, and that's kind of where pharmacotherapy comes into play. In integrative psychiatry and functional psychiatry, we're really looking at all different kinds of inputs. So yes, we're thinking, biologically, we are thinking about neurotransmitters. We're also thinking about hormones, and if those are optimal, we're thinking about nutrient deficiencies, food sensitivities, the health of our gut. There's so much more talk on the gut-brain axis the past, decade or so. And so we're thinking about people's biology that way. We're also thinking about sleep, not just the quantity of sleep, but also the quality, because that plays a huge role in how we feel day to day in terms of our mood, energy, anxiety. We're also thinking about people's spirituality. And, that's not just limited to religion, but also just, how we make meaning and how we connect with other people. So that could include things like mindfulness, meditation, grounding, being part of a community of some kind. Yeah, so that's overall, that's kind of how I think about integrative psychiatry and the difference in as opposed to kind of conventional psychiatry.
Yeah, it's really helpful to hear all those different aspects. And one of the things that I always say about integrative psychiatry is that it's just good psychiatry. Like there's nothing special or unique or new agey about it. I think sometimes people think it's maybe a little bit fringe, but actually it's just really good medicine. And it's looking at all these different aspects that you just listed out. And it's so interesting about the gut-brain axis. Like you were saying, in the last 10 years, there's been a lot more interest in that. Because when I was in med school, I won't say how long ago that was because it sounds like a really long time now. But when I was in med school, I went to school in Cork, University College Cork, which is in Ireland. And they have a huge research center on the gut-brain connection, basically on gut health. And so back then, they were doing a lot of really interesting, they still are, but there was a lot of really interesting research coming out on this whole gut-brain axis. So in our psychiatry lectures, they actually did talk about the gut. So it's really cool to look back because I didn't realize that was such a new idea. It wasn't really mainstream yet at that time. So that was really fun. And even in between classes, we would walk through this microbiome building where they were doing a lot of this gut-brain axis research. So that's the UCC microbiome lab. So speaking of the gut-brain axis, Ailar, that is one of your core areas of specialty, and you help patients in our practice for that. So can you tell us a little bit about what is functional nutrition? Because I think a lot of people have heard of nutrition, but maybe not functional nutrition. So what is that?
Yeah. So, one of the things that I love about our practice and what makes us really unique is how we can kind of incorporate gut health, mental health, which should really just be called health, because it's all part of your overall health and what makes us healthy as individuals. So when you combine functional medicine and nutrition together, you can really look at gut health and the role that it's playing in improving not just your physical health, but also your mental health. And nutrition is really the core, I believe, of functional medicine and what really goes on in the body and the gut microbiome and the role that it plays. And this term gut health has just been growing so much over the past few years, and people are getting curious about their gut health. They're asking their primary care providers to help them heal their gut health, but their hands are sometimes tied and the resources are limited, but also the time is limited in a conventional medicine setting. So I've worked in conventional medicine settings. And what I've realized is that patients want that individualized care, but you're really limited with your time and you don't have access to all these great laboratory testing, supplements, right? Nutrients that we can utilize to help really support the gut microbiome and our mental health as a result. So defining what functional medicine is, I think is really important as a start to understanding what functional nutrition is. So functional medicine really allows us to dig deeper and find the root cause of a lot of chronic conditions, especially. So we don't really just look at symptoms, but we look at what are the symptoms telling us, or not just what symptoms are happening, but why are they happening? So that's what functional medicine allows us to do. And it's not just a Band-Aid method where we cover up the symptoms with medications, drugs. We actually try to use a holistic approach, as Josh mentioned, looking at sleep, spirituality, lifestyle, diet, exercise. And then where nutrition can come into this is, what are you eating? How are you eating? How are you preparing your meals, right? What do your meals consist of? Are you eating mostly whole foods, or are you eating more processed packaged foods because you don't have time to prepare your meals? So through a functional nutrition approach, we can utilize the functional medicine setting and using the right questions, doing the overall assessment. We use questionnaires that can give us a lot more answers. And then we really focus in on improving the gut health, improving the gut microbiome, so that we can allow our bodies to properly generate these hormones and neurotransmitters that can positively impact our health.
Yeah, and it's really cool to see, what both of you do with your patients, like how you both approach your patients, because you both share this focus on gut health and nutrition and using that as a foundation to support people with their mental health. And so that's really cool, because I think that's a unique aspect of our practice, that someone can come in and work with Josh. And if they need help with medications or other things, he can support them with that, and also help support them with the gut health and nutrition piece. And then have them also work with Ailar for more specific guidance on the nutritional aspects as well. So there is really like a tag team kind of approach. So Josh, can you tell us a little bit more about, what do you help patients with? Like, what are most of the people that you're working with, like, what are they struggling with? And what are some of your areas of focus?
Yeah, people come in with all sorts of complaints and also goals. A lot of times I'll hear people tell me that they're just feeling a lot more down than usual. Maybe, they're just not enjoying how things are going, really feeling like they're just kind of going through the motions. A lot of people are also struggling with anxiety, a lot of worries, feeling really stressed, either by, what's going on in their lives, their work. A lot of people I see also have physical health issues that end up causing them quite a bit of distress too. A lot of people are not sleeping as well as they would like to be sleeping. Also, energy is a big one. A lot of times people just feeling kind of run down, even if they do feel like they're getting adequate sleep, they kind of feel like they're eating a relatively healthy diet, but still just not feeling very energetic. So where I start with everyone is just, doing a really thorough assessment, finding out about their history, medical history, mental health history, family history, And then also just get a really good snapshot of what's going on now, the kind of stressors they're dealing with, any kind of stress management practices they have, and then figuring out their priorities and taking it from there. I really think that like comprehensive lab work is a really important place to start. Nutrient deficiencies, and blood sugar imbalances, and things along those lines. Even really low cholesterol, which there's quite a bit of literature on low cholesterol being a risk factor for depression, even suicide and suicidal behavior. So doing really comprehensive lab work to start, treating and addressing any nutrient deficiencies or other imbalances that come up, and then kind of taking it from there. We have access to a lot of specialty functional lab testing, so for some people that's appropriate, and then just kind of start chipping away and monitoring for progress with the interventions that we use. And that might be medications, it might be supplements, a lot of lifestyle things. So that's kind of where I start.
Yeah, and it's really helpful to hear your approach, because I think one of the maybe the misconceptions people have about holistic or integrative psychiatry is that it's anti-medication, or they shouldn't take medications, or things along these lines. But actually, medications can be life-saving in many cases, and it's not about eliminating medications necessarily. For some patients, that actually might be appropriate, tapering off. But for other people, it's really about using medications as a tool, but also implementing all of these other things as tools as well, and not ignoring these other aspects.
Right. Which, oftentimes introducing those other kind of lifestyle modifications and really dialing in nutrition, those things can actually be helpful for people who are very, very motivated to reduce their medications or discontinue them ultimately. I have a lot of people come to me also, maybe they've been on a medication for a long time. They really would like to get off. They're doing well, but there are some areas of improvement. And that's something that I really enjoy doing too, is just supporting people through that discontinuation process.
Yeah, it's so, as we were discussing, it is really helpful to look at all of these different aspects. And it's interesting you brought up blood sugar, because Ailar and I were just talking about that before we started this chat together, and just the impacts of fluctuations in blood sugar and how that can affect mental health. But again, tying that back to nutrition and gut health. So Ailar, could you share a bit more about how you work with people and why people come to see you? What are some of the more common issues that you work with?
Yeah. So, when we talk about blood sugar management, it's oftentimes patients don't come in and say, hey, I'm having a really hard time managing my blood sugars, or they don't come in and say, I'm having metabolic issues. You'll hear more of the symptoms that they're experiencing and the signals their bodies are sending them, as long as they take the time to pay attention and listen to it. And what happens oftentimes is these problems become so chronic over months or even years, until a lot of our clients actually decide to come see an integrative specialist, or someone that can really dig deep and figure out what's going on. So a lot of the common symptoms I hear have to do with the digestive system, common symptoms like bloating, gas, constipation, diarrhea, abdominal pain. And when they become more frequent to a point that it's bothersome, that's when the clients tend to come to me and they're asking, okay, am I allergic to something? Am I sensitive? What's going on? Do I have an infection? So we really have to do an assessment and see, okay, what other symptoms are involved, because that gives us the whole picture of what's happening. It's usually not just in the digestive tract. People might have difficulty focusing, as Josh mentioned. They might have mood swings, or they might have difficulty focusing. So those are some of the most common symptoms. Or when it comes to metabolic issues, people might just say, I was losing weight and it was going really great, and now I'm just stuck and I can't seem to lose any more weight. And that's where we can do a more holistic assessment, looking at their lifestyle, their exercise, utilizing things like stress levels and sleep that you would address in your sessions. And then as far as how I approach it, so one thing I really like to do is a questionnaire through the Institute of Functional Medicine that gives me all the symptoms a patient is experiencing from start to finish. Because what they're reporting is the ones that are more severe or more bothersome, but they might forget to mention a few things that can also be important and taken into account. So doing this assessment gives you more information. Plus, a lot of times what conventional medicine setting doctors or non-holistic practitioners don't have the time to do is really ask, what are you eating, right? So they'll say, okay, are you getting protein to help control your blood sugars? And patients will say, oh yeah, I eat chicken, I eat fish, I eat eggs, but they're just saying that because they eat it a couple times a week. They're not saying, okay, for every single meal, I'm getting enough protein and my blood sugar is being managed. So what I do is a 24-hour diet recall, or sometimes I'll ask patients to give me 3 days in a row of what they're eating. And that gives me a better assessment of, okay, how are you really eating? And giving me an honest answer about what your schedule looks like, how big are your meals, how frequently are you eating? So those are some of the approaches I take. And then really getting into talking about what gut health is. So a lot of time I like to explain the gut-brain connection and what's happening inside the body so that we can understand why we're making these changes. And once a client really understands what they're doing, but also why they're doing it, usually they'll have a more successful chance of complying with treatment methods and then also being successful in the end for improving their overall health. And as I mentioned, when it's chronic, a lot of times people are just so frustrated and they want like a quick fix. So medications and supplements can be helpful for that, but we can't just use that to cover up a poor diet. We can't use that to cover up 2 hours, 3 hours of good quality sleep or really high stress levels. So we can utilize those things, but we really have to do dig deeper and do a better assessment to really fix the root cause, which often is a poor diet or lifestyle habits that need to be changed.
That's a really great point about the supplements, because sometimes we will see this happen where someone doesn't want to take a medication, so it gets replaced with a supplement. But we're still missing all of those other aspects of getting enough sleep, establishing good lifestyle habits and all of this. So integrative psychiatry and integrative medicine is not just about using supplements instead of medications, but again, it's this true sort of holistic approach. And I think one thing that's really cool that I've seen you do, Ailar, is that you're really, and Josh does this as well. I mean, you both do this really well, is meeting the patient where they're at. Because I saw one of our patients this morning, and she didn't necessarily want to go into all of the precision functional testing that you offer, but she just wanted to know, what should I eat for breakfast? What should I eat for lunch? I have anxiety. I have depression. It's overwhelming for me to go to the grocery store and figure out what I should be eating every day. So can you help me with that? So you're able to do that with people. Start with the basics if that's what they want, or go into the really kind of, deep precision biohacking kind of space as well. And I've seen both of you do this.
Yeah, definitely. And I always try to kind of understand not just the diet exercise piece, but what does your day-to-day look like? So I ask clients, do you work? Do you work from home? Do you have kids, right? So what does your schedule look like? And are these goals really realistic? So one thing I talked about a couple of weeks ago was, how realistic is it to eat whole foods every single day, right? So eating fruits and vegetables, good sources of protein, healthy fats. And oftentimes for many of us, that's not realistic. And a lot of times people will get down on themselves and say, I had, a frozen meal from Trader Joe's, I messed up. And, that's not really something that's going to affect you long-term, I would say. It's more so about what you do more consistently and what you do most days of the week. So that's where I try to meet the client where they're at and set a realistic goal, whether it's about diet or even something really important like hydration, which oftentimes gets overlooked. So clients will always say, when I ask the question of, okay, how much water are you drinking a day? The most common answer I get is not enough. So people know they're not drinking enough water, but they're not really willing to take that step of increasing it. Someone who's drinking 3 cups of water a day, I can't just say, okay, you're going to drink 12 cups of water a day. But where are you working? Do you have access to a restroom? Let's be realistic about that goal. So increasing it from 3 cups to 4 or 5 cups is more realistic than going from 3 to 10 or 12.
Definitely. And Josh, so I'm curious to hear your thoughts as well on some of these issues. And also, I think one of the more common issues that we see in our practice is people being in this fight or flight response, like activated what we would call the sympathetic nervous system, just a lot of anxiety. I mean, we work with people in California, people have high stress, high pressure jobs. Their mind has to be active all the time for their work, or they need to be thinking about things on meetings. And so it just puts them into this chronically activated state. So nutrition can certainly play a role with that. So I'm curious to hear your thoughts on that, and just generally how you might support a person like that using your integrative approach.
All really good points. And I mean, I totally agree with the idea of meeting people where they're at. Like, we're not, I'm not going to ask somebody who right now is skipping breakfast and lunch to, have 3-course meals for every meal of the day. It's just not going to happen. It's not sustainable. So might sound great on paper, but that's not where I'm starting. Like, I was talking with someone earlier today, and currently, like, she's not having breakfast and not wanting to spend a ton of time preparing. We talked about, like, what's the bare minimum we can do. And so we ended up talking through like 2 or 3 eggs and some avocado. And that's easy enough. Hard boil a bunch of eggs at the same time, and you have them ready to go. So that's an example. But I also agree. A lot of us are not taking time throughout the day to just kind of slow down. I know you had a video on this the other day, and it's we often feel like we don't have the time, to do something. But the truth is we actually don't have the time to not like take time to slow down. The time we get back from maybe spending a minute, like doing some deep breathing, that the return on investment is like really significant for that. And so oftentimes, in kind of tying it in with digestion, when we're in a sympathetic state, when we're really, really like anxious, or if we're like running from meeting to meeting, or if we're driving, we're not getting into the parasympathetic side of our nervous system, which is the rest and digest. And when we're not doing that, when we're not relaxed when we're eating, we're actually not doing as good of a job as we could with digestion and absorption and assimilation. Because when we're feeling really stressed, we're not producing the hydrochloric acid that we need in our stomach to really break down protein and take advantage of those amino acids. And so, yeah, with a lot of people, we just start with, 3 deep breaths before every meal, trying to, more often than not, eat without distractions, not being in on our phone or driving, just kind of having that time to be kind of sacred. And it's hard to imagine that the way we eat would affect how we kind of make use of the nutrients as much as what we're actually eating, but it really is true.
Really makes a big difference. And I know Ailar probably has some more to share about that. She speaks about mindful eating. Ailar, do you want to just piggyback on that?
Yeah, absolutely. And, this is one of the things that I was talking about as well a couple of weeks ago, saying there's so much focus on what we're eating and not so much on how and when we're eating. So as Josh mentioned, taking the time to really sit down and eat and slowing down while we eat, right? Especially a lot of people are working, 9-to-5 jobs or 8-to-5 jobs, and they have a 30-minute lunch break. So they take some of that time to actually get out of the office if they have a chance to do that. And then they eat their meal quickly, because then they want to spend some time to sit there or like go on their phone or do something else. So then the digestive system is kind of shocked at first because they've gone several hours without eating, and now they're just quickly eating a meal. They're not really taking the time to chew that food. And the digestive system has to release a lot of enzymes and acids, as he mentioned, and it gets shocked. So then people are thinking, well, why am I bloated? Why do I have heartburn? Why do I have abdominal pain? And it's because the digestive system is not getting a chance to go into that parasympathetic nervous system to really break down the food properly. And then after the meal, we return back to the work environment, or we get up and we start doing another task. So then we put our bodies into that stressful or sympathetic nervous system. So I always say, take the time to sit down while you eat, first of all, and if possible, take the time to just sit after you eat. I was talking to a client the other day and I said, hey, why don't you set a timer on your phone for at least 5 minutes, ideally 10 minutes after you eat, to just sit there and do something relaxing versus getting up and going back to the workstation or getting up and doing another activity, and see if that reduces the bloating. Because oftentimes we want to say, okay, well, maybe I have an infection, or like maybe I'm sensitive to a food that I'm eating, but sometimes it's just slowing down while you eat. And if you're really not able to do that consciously, one thing that I recommend that's kind of silly to do, but it does work, is eating with your non-dominant hand. If you've ever tried it, it's like brushing your teeth with your non-dominant hand, brushing your hair with your non-dominant hand. We're not really well coordinated, and it causes us to slow down when we pick up the food, put it into our mouth, and you consciously start to eat slower. And as Josh mentioned, when you avoid the distractions like watching television, going on your phone, you're so focused on what's happening in front of you, which is the eating, and it causes you to slow down and maybe even chew your food more thoroughly, which prevents the digestive system from having to do all that work. When it's happening in the mouth, which is also part of the digestive system, a lot of people think, oh, it's just like the gut and the stomach and, the intestines, but the mouth is part of the digestive system, and a lot of enzymes actually are produced in our mouth. So yeah, I think mindful eating is something that a lot of people are learning about now, but applying it is really tough. So meeting the client where they're at and seeing, okay, what mindful eating concepts work for you based on your schedule, based on your lifestyle, and how is it something that you can stay consistent with, not just for a couple weeks to get rid of your symptoms, but how can it be a lifestyle change?
Definitely. And I've seen that tip of just waiting a few minutes, like just sitting for a few minutes after you finish eating, have huge impacts. There was one patient who was struggling with a lot of indigestion. And so I recommended to him, just wait like 2 or 3 minutes or 5 minutes after you finish eating before you get up. Because I know a lot of us, myself included, I have to remind myself to just sit and wait. Otherwise, I'm still chewing and picking up my plate and taking it to the sink, and I'm washing dishes and I'm still chewing. Like, it's just not good for the digestive tract, right? So just sitting there, allowing your body that few minutes can have a huge impact. So lots of great information. Thanks to both of you for being here today and sharing your knowledge. I think there's a lot more we could share, so maybe we'll schedule another time to go into other aspects. But so Josh works with patients across California. We're fully remote, so we're seeing patients via telemedicine within the state of California. So he works with adults, basically 25 to 55. With anxiety, depression, sleep issues. We can help with medication management, and of course, all of these other integrative aspects. And then Ailar, same thing. She's able to see patients remotely, working with adults for help with nutrition. And we really have this care team approach. So you can see both of our practitioners to get a fully integrative approach that I think is really unique at Pacific Integrative Psychiatry. So if anyone's interested in learning more, check out our website at pacificintegrativepsych.com. So thanks again to both of you.
Yeah, thanks for having me.
Thank you.